focusing on healthy insides and healthy outsides for patients, and then to see them as they gain that confidence and go through the process is really amazing.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Michelle Doran, who is co-founder of RN Aesthetics, and she started it in 2012 and became one of the first board-certified aesthetic nurse specialists in the nation. She has the distinction of being one of the most sought-after national trainers for Allegan Medical Institute since 2015. She is also assistant clinical faculty for the Academy for Injection Anatomy Cadaver course and one of 12 aesthetic masterminds in the US. She is known as a hippie in medical aesthetics, often found in her scrubs and Birkenstocks. Michelle is also an expert in all things injectables and focuses on natural outcomes. So Michelle, welcome to the show and glad to have you here.
Thank you so much for having me.
Yes, let's dive into it. How did you get interested in aesthetics?
So I was a surgical nurse at Brigham and Women's. I got my nurse practitioner. I was doing primary care, and it seemed at the time, probably I graduated in 2002. For the first couple of years, as Botox came out, I had a lot of patients coming in for primary care issues who were starting to ask me about Botox and about lasers. I seem to have been managing a lot of patients coming into the urgent care with, skin issues. And I just thought, you know what, this is a fun area of medicine that I wanted to explore. So I ended up taking a Botox course and a course on dermal fillers. And it was a weekend course, and I started doing it on the side as I was doing my regular job as a nurse practitioner. And I just loved, not having to deal with insurance, being able to spend a lot of time with patients, and just making people feel good and confident.
Got it. Now, can you discuss some of the most popular treatments that your patients come to you for, and also why do you think that they're so popular?
Well, definitely Botox. I think everyone's having Botox, or for the boys, we say Brotox. But that's probably one of the most common things that we do in our practice. And then hydrofacials. We're a huge hydrofacial practice. So we do a lot of combination skincare and injectables in my practice. And the third most popular thing we do is laser treatments. We use all Cyton lasers, so we do a lot of BBL, which targets reds and browns in the skin, sun damage. We do halo lasers and Moxie, which are resurfacing laser treatments. And that's probably our top three most popular treatments. They're good for everyone. Everyone can benefit, and male, female, doesn't matter, skin type. So I think that's why they're so popular.
Okay, got it. Now, are there any new or emerging treatments that you're particularly excited about?
Well, definitely growth factors and exosomes, I think are really cool. There's definitely a trend toward natural outcomes and not having these overfilled aesthetic treatments where people are not looking themselves. The Hollywood kind of scare that people always come in and say, I don't want to look like so-and-so. That's all really trending away from the aesthetic industry. And I think now we're focused on really skin health, lasers, using growth factor, collagen stimulator treatments, exosomes for the skin, and rejuvenative medicine. So really aesthetic beauty starting on the inside out.
That's actually one interesting thing that as I've been interviewing more and more people across the country, a lot of them are starting to make that transition into regenerative medicine, into functional medicine, and really more of this inside out beauty approach instead of just on the surface.
Yes.
So I think it's interesting that people have gone in that direction, and especially like looking for the more natural look. It's like, I don't want to look like I've been worked on. I just want to look naturally good.
Yes. Yep. The best injectable is not detectable, they say. And patients should feel comfortable and not have anyone saying, oh, did you just get work done? Because I always tell my patients, if somebody's asking you that, then it's not natural. That's not the goal.
Yeah. Now, what would you say about what are some ways that you really differentiate your practice from others in the industry? I mean, you have 3 locations now, so your practice has been growing quite a bit. So what would you say are the biggest differentiating factors?
One is that we are 30 women in my practice, so we're all women, and we're nurse practitioner led. So even though we collaborate with dermatologists and plastic surgeons, we're really a group of nurses and estheticians providing these treatments to patients. So we have a different focus. For patients, we have a really nice aesthetic relationship with patients. They feel comfortable with us. In my practice, I think one of the things that differentiates us is that we're down to earth. You come in, we're in scrubs, we look natural. We want to see what your concerns are and create a treatment plan for you. People don't feel intimidated when they come into our practice, which in the aesthetic industry, sometimes even me as a trainer, I can go into a practice and people look great, but they're in high heels and Chanel suits and things that maybe as a lay person, I don't necessarily feel that this might be a treatment for me if that's the way the practice is set up. And so we just try to take a very natural approach, very down to earth approach, make people feel comfortable when they come into our practice.
Got it. Now, you talked a lot about the approach you take for patients that are coming in. So when it comes to educating your patients, how do you approach educating your patients about services you offer and also the benefits of it, particularly now that you're making this shift to regenerative medicine, which I think that not everyone really understands. So how do you approach that education so that they can appreciate and they know what the benefits are?
So we always try new patients to do a comprehensive consultation with one of our nurse practitioners as a nice way to start. And we go over what their concerns are, and we really lay out a comprehensive treatment plan for them. And it can involve skincare, hydrofacials, peels, injectables, lasers, kind of a whole approach. And they can really decide based on what our recommendations are, which types of treatments feel comfortable for them. Not everyone wants to do injectables, and that's okay. And then we just educate them about what's available, what we think based on what their concerns are, what we think the best treatments would be for them. And we just email them that comprehensive treatment plan, provide them with some information about the particular treatments we're recommending and why. And so they feel like they have that holistic approach to meeting their goals.
Now, you mentioned the word holistic, and I think that's something that maybe not necessarily everyone really knows when they think about aesthetics. They think about, oh, aesthetics, I want to have this thing look better, so I just need Botox and that's it, or I just need fill and that's it, or I just need this laser treatment and that's it. But when you say holistic, there's a lot more that goes into that treatment. It could be a combination of many things. Would you say that that's kind of in line with what you're seeing with your patients?
Absolutely. They come in, the first thing we know, skin is the largest organ, and you look younger when your skin looks healthier. So our whole approach is really starting with making the skin look healthy, feel healthy, educate patients about what they should be using at home to treat their current skin conditions, but also prevent advanced aging, using sunscreens, using antioxidants. So we do a lot of education about just your skin in general and what you should be doing. And then, as I said before, not everyone wants to have an injectable approach. And I think the best treatment plan is using medical grade skincare, having some clinical treatments, and or having injectables done. And so we try to really see what the patient would feel comfortable with and provide them a plan that really addresses that in a comfortable way.
Okay.
Dermal fillers, sometimes I'll say to patients, I think doing a dermal filler, which I hate the name filler because then you think, well, I don't want to look full. So I'll talk about injecting hyaluronic acid to hydrate your lips or give you a little support in your mid face, give you a little bit of contour in your cheeks rather than filling you and having you feel unnatural. And often when you educate patients about, you know, I have these treatments done, I look natural, then they feel more comfortable. I always explain to them that when you see someone who looks weird, that's not the norm. Most people are walking around, they've had aesthetic treatments and they look good. And you see them and you're like, geez, she looks really good. She looks rested, looks like she had a good night's sleep. Doesn't look like, she's got 4 kids running around. So it has to be a more holistic approach, I think.
Got it. Now, within that vein of education and kind of advising your patients on the best way to go, how would you describe really the biggest difference between what a medical spa, those type of treatments, and compared to like your traditional cosmetic surgeon? Like, what are the biggest differences between those two types of treatments?
Most med spas are focused on the non-invasive or minimally invasive procedures. So we focus on things that really are non-surgical with little to no downtime for patients. And we can be as aggressive as the patient can tolerate, but generally the downtime with procedures we have might be a couple of days. And we refer to it as more social downtime. If you're comfortable going out, go out. But if you feel uncomfortable because your skin is red or you're a little swollen, that's fine. You just plan around that. Whereas more of a surgical approach, like a cosmetic surgeon practice, sometimes they're offering those minimally invasive procedures as well, but they're also focused on more invasive surgical procedures, more ablative lasers with more downtime, that type of thing. So I do think as aesthetic providers, it's important to collaborate and work with those cosmetic surgeons, plastic surgeons, etc., for the patients that really do want to have a surgical treatment or something more aggressive, or perhaps, we're not able to meet their expectations or needs, we refer them out. So we definitely collaborate, but we're focused on more of the minimally invasive treatments.
Got it. Now, when it comes to the patients that are coming in, I'm sure that a lot of them have misconceptions about what you provide. In some situations, maybe they do know what they need, but I'm sure in a lot of situations, they don't know what they need. Or
Yes.
they know, but they really don't need that. So what are some common misconceptions you would say that patients come in that they have about the treatments you provide?
A lot of patients don't know a significant amount about Botox versus dermal fillers, hyaluronic acid treatments, like what the difference is. So often they'll come in and they'll say, I want to address my neck or lower face, and they're thinking that they need one particular treatment when maybe they need something different than what they thought. So I'm always trying to assess what it is that bothers them and then educate them. Actually, Botox would be great for this particular concern for you, and here's why, and here's how it works. Or I think Sculptra, injecting a collagen stimulator, would be good for you. And social media, there's a lot of misconceptions, based on social media. Patients think certain things look really easy and safe, such as, let's say, injecting filler in the nose. And that's a really high risk procedure, but because we see it on Instagram, it seems so easy. So patients will come in sometimes asking for certain things that I just say, actually, I don't think that would be a good option for you, and here's why. And, maybe they read it somewhere, their friend suggested it, but the social media is a blessing and a curse in some ways for aesthetics.
People want to look like that, like an Instagram filter.
Yes. And often they'll show you a picture. Well, could I get, lips like this? And it's super over filtered, photo, and you have to say to them that that's really not that's not how that person looks. So getting away from filters as kind of a standard and talking about really what's achievable, and that normal skin has pores and has wrinkles and lines and a little bit of pigment, and we can make it address those things and make you feel more confident in your skin, but we can't get rid of them altogether as we're aging.
Okay. Now, once a patient does decide on that treatment, how do you balance providing that relaxing experience for them, but also at the same time ensuring their safety and well-being?
Yep. So we always go over the treatment, the consent form, the risks, expectations in terms of downtime, things that may happen, such as bruising, swelling, things like that. So they're mentally prepared. We provide them post-care instructions so they know what they can and can't do after the treatment. And my team is amazing at doing a follow-up the next day, checking in. How are they doing? And if they have any concerns, having one of our nurse providers speak to them. We'll bring them in if we need to, or FaceTime them, just so that they feel comfortable as they're going through the process. So it's all really about the education and setting up expectations for patients.
Got it.
Yeah.
Now, when it comes to medicine, people have this idea in their head that, oh, you have to follow a certain procedure, there's a protocol, there's a process. But what role would you say creativity plays in how you approach patient care?
Yeah, I mean, that's one of the beautiful things about aesthetics is it really is combining artistry and medicine together. So, when I look at a patient's face, there are things that I'll point out to them just based on my artistry, asymmetries that are natural, whether they have one larger eye, one smaller eye, just you can tell what side they sleep on, those types of things. And so having a really good aesthetic eye and tapping into your artistry can really improve the outcome for patients. Also, just being comfortable looking at the whole face for your patient and making sure that, if I'm gonna do a lip augmentation treatment for them, do they have the chin to support it? Do they need a little bit of lower face support? And educating your patients about that. But that really takes an artistic eye and approach. And I've trained and mentored people who they just don't see that, they don't have it. And so they learn as they go, or they take a different approach. But the artistry is really interesting and fun when you're creating aesthetic plans for patients.
Yeah, it really is an art and a science. It's not just one or the other.
Absolutely. Yes.
Yeah. Now, throughout your experience, I'm sure that you must have come across some particularly challenging cases. So could you talk about one situation where you had a tough case, challenging case that came to you, and how you were able to get them a successful outcome in the end?
I think, we see a lot of patients who come in with really severe acne, let's say, or really bad melasma, hyperpigmentation, that, they'll come in and their faces, you can tell when they come in, they're kind of hiding behind their hair. They're wearing a lot of makeup, and just taking that approach with them of talking about a treatment plan. Often I'll involve my estheticians, my laser nurses, and watching patients come back each visit and seeing the difference in terms of their confidence is amazing. So when we had a patient with pretty severe acne who had been to a dermatologist, had been on multiple medications, and just creating a treatment plan for her, watching as she came in, just the confidence grow. The way she positioned her body, the way she spoke, her eye contact, all of those things. And then she was somebody who let us share her before and after on social media, because she really wanted other people to see her journey and feel comfortable, taking that jump and having treatments.
Yeah, I think that's a very powerful thing that you just mentioned, like that story in particular, because I think when people think about aesthetics, they think about, oh, it's just about the vanity, it's just about looking better. But whenever I ask, like, what's your best success story? Like, what's the one that really stands out? Almost always it's always like, oh, this person was suffering from this condition or this condition, and they just wanted to feel normal. And
Totally.
once we did that, it changed their lives. And I think
Yes.
the really powerful underpinning like behind that message is aesthetics is not about necessarily looking vain or vanity. It's really just they're suffering from some type of condition and they just want to look normal. And
Absolutely.
that's enough to change their life.
Yes. And a lot of times we'll see people in the most vulnerable stage of their life. For example, we see a lot of women that are going through marital problems or going through a divorce, and that, they come in because they want to feel better about themselves. They want to invest in their own self-care. And then to see them as they gain that confidence and go through the process is really amazing. I mean, we see people, get new jobs, and I've had patients that went through a divorce, had a really difficult time, and are happily remarried. So just being part of that process for them. And I love when I see some of my patients on social media and they share a photo, and I just comment to them that they look beautiful, and they always will credit us for being part of that journey for them. And it makes us feel like what we're doing is more than just vanity. It's really making people feel comfortable and confident in their own skin. And if they feel better, they do better. And then it's just a cycle.
Yeah, that's fantastic. I think that's a really important message that people have to understand about the aesthetics industry. It's not just the vanity side, it's about changing lives. They're making people feel like giving them the confidence.
Absolutely. Even we started a weight loss program, tarzepatide, so like Manjaro, the compounded version. And to see people who have lost 30, 50 pounds and looking at their before photos and then their progress and their after photos, it's amazing to see just how good they feel. They're running 5Ks now. They have a lot of energy. They're playing with their kids. And it's more than just, giving them something to make them lose weight. It's about changing the whole way they live and feel.
Yeah, that's fantastic. Now, Michelle, where do you think the future of aesthetics is going?
I definitely think beauty from the inside out, regenerative medicine, focusing on healthy insides and healthy outsides for patients, exosomes, growth factor. Hopefully we continue to see really amazing lasers that can cause non-surgical results for patients that make them feel less and less like they need to go under the knife. I mean, there's always going to be patients who need surgical procedures, eye surgery, facelifts, things like that. But the more we see in terms of technology improving for non-surgical procedures and minimal downtime, the more patients are going to be doing those types of procedures and maybe postponing something more surgical.
Okay, got it. Now, Michelle, I have one last question for you, but before I ask it, I want to point people to your website at www.rnaesthetics.com. Now, the last question is, what would you say is the most important piece of advice you can give to someone who's thinking about getting an aesthetic procedure done, but isn't sure which provider to choose?
I think, referrals are always great. Asking your friends. People these days don't gatekeep. They're more willing to share if they're having procedures. So if you have a friend that looks really great and they look natural and that's your goal, asking them where they're going for their aesthetic procedures, who they're seeing. And then I think watching on social media, do you mesh with this person? Or with this practice, does this feel like a comfortable practice for you? And then I always recommend coming in to a practice for a consultation. Sit down with a provider, see if you jive, see if they're meeting your needs or listening to your goals. And there's nothing wrong with going to several places, doing consultations and figuring out what the right provider and practice is for you, because there's somebody for everyone. So I think it's just finding the right fit.
Got it. Well, there you have it, Michelle sharing her expertise. Now, Michelle, where can people contact you in your practice?
Through Instagram, RN_aesthetics_MA. And I manage the social media. So if they DM me, I will definitely respond back. And then through our website, they can shoot us an email And those are two best ways to keep in touch.
Great. Well, thanks for being on the show and sharing your message.
Thank you so much for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.